And welcome back. March 10th is National Women and Girls HIV and AIDS Awareness Day, which is a day to focus on the work being done to reduce HIV and AIDS diagnoses amongst women as well as young girls. Now, Amida Care has developed a highly effective specialized model of care that provides individualized attention and support to people with HIV and AIDS as well as other complex health issues. Sharing now more details, we're pleased to have the Assistant Director of Member Events at Amida Care, Sandrine Blake. And Sandrine, good to have you.
Great to be here. Thank you for having me.
Well, we want to talk a little bit about Girls HIV/AIDS Awareness Day and a very important time for you. But talk to us a little bit about the significance and the importance of this day.
The significance of this day is just really important, like you said, Darren, in highlighting what's being done to reduce the risk of HIV diagnosis among women and girls within our communities, especially across the nation. We definitely want to highlight the struggles. We want to show how these women have been coping, how far we've come with research, with information and data, and just showing some of the disparities, especially within our own community here in New York City. Some recent data from 2020 is showing that 95% of new diagnoses in New York City were among women of color. And it just shows that there are disparities within our city and things that we still need to highlight and work on to get to where we need to do in lowering the epidemic rate right now.
When we talk about the epidemic rate, we do know that the rates are continuing to grow. We know that there are challenges that are out there. So for somebody that may not be so familiar, what are the challenges that particularly young women are dealing with when it comes to HIV and AIDS?
Some of the challenges young women may be seeing is access to care, discrimination, socioeconomic challenges, overall stigma, poverty, and even just locating where where you can go, where the doctor's office is and a local clinic, having that comfortability to talk with your provider. There may be other issues in the home or at school that may stop someone, especially someone of a younger age, in going and just even finding out your status. It starts with finding out your status, just getting tested. There is so much fear in just getting tested, and that's where it begins. And even if you get a positive diagnosis, it is not a death sentence. We are in 2022, and we have ways that you can live a healthy, viable life, even if you're affected.
So when we talk about this, we know that there's that fear stigmatism, and you highlighted that earlier, that even to this day in 2022, there's still a lot of fear. But for women out there who may be at risk, women out there who may be dealing with this particular challenge, give me some advice that you would like to share with them to help them along the way to get past the fear stigma and possibly move in the area of receiving resources.
Oh, definitely. Again, the first thing, get tested, right? Go to a local clinic, a hospital, doctor's office, and get your status, right? From there, even if it's a negative status, but you might be, at fear because of potentially the lifestyle you're living, you might be at a at risk nature. There is pre-exposure prophylaxis, and it's known as PrEP. And it's critical in fighting against the HIV virus. It's a one-a-day pill that individuals who are negative can take that has a 90% effective rate in preventing HIV transmission. And that is just the start. Especially for those who may feel they are at a higher risk in getting the virus. There are other options out there in just maintaining your medical health. And it starts with knowing what you can do. It starts with identifying community-based organization, a proper healthcare provider like Amida Care that can start to help you navigate this path to a better, healthy lifestyle.
So, as you mentioned, you're from Amida Care, and Sandrine, I want you to share with us a little bit more in this area because you provide services and you actually are helping women with boots on the ground who are dealing with this issue. So, a little bit about Amida Care and the work that you guys are doing, particularly in this area.
Well, definitely. Thank you for asking. Amida Care is a community-based health plan. We are the largest Medicaid special needs plan based out in New York City, and we look at healthcare in a more comprehensive way. But I want to say it's not just about medication, right, Darren? It's
Mhm.
about the whole care of an individual. And we often even find that we're taking a holistic approach in ensuring that our members are fully cared for, because we want to ensure, do you have transportation to get to your medical appointments? There might be an issue with food in the home, like food insecurity, where we want to connect members with other organizations to help them with some of these issues. Amida Care's motto is health, advocacy, and care. It's about making sure our members are fully healthy, right? And giving them that seamless access approach to their health path. And then it's also about advocating, going and lobbying for Medicaid and healthcare rights, right? Not just around HIV, but also around socioeconomic conditions that may be facing many of our members. It's also about housing. It's also about, our advocacy for our trans women that are on our plan and our members who are of the transgender experience, and ensuring that they have access to get the care and to surgeries that are needed for their own mental health, their physical health, and their overall spiritual and emotional health as well.
Yeah, I want to go over some numbers because I think numbers will put things in better context, particularly for those who are here in the borough of the Bronx and across New York City. In 2020, 95% of new HIV diagnoses among women in New York City were women of color. In 2020, 60% of newly diagnosed cases of HIV among women in New York City were Black women. And also, 24% of all New Yorkers living with HIV are from the borough of the Bronx, a total of over 30,000 women, and the Bronx having the highest percentage of people living with HIV out of any borough in New York City. Given these statistics, are we seeing more and more women, particularly from the Bronx and in our area, coming through the doors and asking for services, or is there still this lack of coming forward?
I want to say it's a little bit of both. We really have to be in depth about the community that we're reaching. Amida Care just doesn't wait for our members to come through our doors. We are in community, like you said, boots on the ground. We are at our local hospitals. We are at community-based organizations. We're at health fairs in within the areas, just ensuring that we have that touch point, because it's great that people can see us as a health plan, but it's even better when they know us, when they can identify me and say, hey, that's Sandrine. She can help me, or I have a friend that she can help. Because sometimes that intimate conversation opens up our women in just feeling a little bit more comfortable and having those a little deeper conversation, because it is a harder topic for some to talk, but it is a topic with any woman or man throughout the city. And it doesn't matter if you are of the trans experience or not. We just want you to be educated on your own health and also how HIV is affecting our community.
Yeah, the work you do is so important. And I mean, obviously, with the numbers and the statistics that are out there, and we see the numbers continuing to rise, particularly in the borough of the Bronx as well as across New York City. Give me just your perspective on the importance of what you're doing and how you feel it's making an impact.
Oh, it's definitely making an impact. It's critical to be on a plan like Amida Care, because we're not just a health plan, we are your health partner. We're really working with you as an individual to say, this is where you're at right now, but this is where you can be with better health care. And again, like I said before, it's not just about taking your one a day pill or getting a shot. It's also about everything else that plays in your whole life factor. So it's really important that we're not just seen, we're heard, we're known. People have access to come to our storefront area. We're in communities providing our wellness events to members, because one of the key things that I do at Amida Care is provide our wellness events. We know that people may not have the opportunity to do yoga, to do meditation, to learn how to prep a healthy meal for themselves. We bring this right into the community free of charge. Like you said, Darren, boots on the ground. We are not just a talking health plan, we're a doing health plan. And that is key, that our community is seeing that we're not just talking the talk, we're really doing it.
Yeah. Well, Sandrine, I want to thank you for the work that you are doing and providing much needed resources, and particularly as we see those numbers that are kind of startling but then alarming. But glad to know that there are people who are out there trying to make a difference. And Sandrine Blake and Amida Care doing a great work. Thank you so much for being with us.
Thank you, Darren, for having me.
All right. And in case you missed it, March the 10th is National Women and Girls HIV and AIDS Awareness Day. Now, if you want more information, we encourage you to visit the website at amidacareny.org. We do have more show. We encourage you to stay with us. Open will continue right after this.